Rahman Rahim. Assalamu alaikum. Good afternoon. My name is Ahmed Al Hadidi. Today we'll continue our presentations for history taking station, and we'll start today with fatigue. Fatigue is fatigue or lethargy or tiredness is a very common complaint and very commonly presented in MRCB basis exams or MRChem exams. For definitions of fatigue, you have chronic fatigue is fatigue persistent for 6 months. Chronic fatigue syndrome is a syndrome of unexplained fatigue that's of new onset, not alleviated by rest, not a result of ongoing exertion, and results in substantial reduction in previous levels of occupational, educational, social, or personal activities, and associated with 4 or more of the following: self-reported impairment in short-term memory, sore throat, tender cervical or axillary lymph nodes, muscle pain, multiple joint pain without redness or swelling, headache of new pattern or severity, unrefreshing sleep, and post-exertional malaise lasting 24 hours. There is a lot of causes for fatigue. Many systems might be affected. Psychological causes like depression, anxiety, chronic fatigue syndrome, eating disorders, and substance abuse. Endocrine causes, very common and very important: Addison disease, diabetes mellitus, thyroid disease, Cushing syndrome, and hyperparathyroidism. Cardiac causes like heart failure, respiratory causes like COPD and obstructive sleep apnea. GIT causes like inflammatory bowel disease, malabsorption syndrome, and cirrhosis. Also neurological disease like myasthenia gravis and multiple sclerosis. Also other causes like infectious disease, most infections like endocarditis, infectious mononucleosis, tuberculosis, HIV, hepatitis, Lyme disease, and post-viral illness. Hematological disease like anemia, leukemia, and lymphoma. Also rheumatological disease like fibromyalgia, very common, systemic lupus erythematosus, rheumatoid arthritis. Medications that might cause fatigue like antihypertensive medications, antihistamines, sedatives, hypnotics, antidepressants, and narcotics. As a differential diagnosis for common causes for fatigue, for anemia, usually you have history of GIT bleeding due to non-steroidal drug taking, GIT malignancy, malabsorption syndrome. Adrenal insufficiency is associated with another autoimmune disease like diabetes mellitus type 1. Myasthenia gravis, it's weakness, muscle weakness more than fatigue, or muscle weakness associated with fatigue, and usually it's diurnal variation. For hypothyroidism, you will have weight gain, dry skin, hair loss, and intolerance to cold weather. To start the station for history taking, or to start the exam of history taking, we will start by the usual sequence: set, dialogue, and closure. Set is the introduction, 5 steps. You will do greeting and introduce yourself. Hi, I am Dr. Hadidi, SHO of Internal Medicine Clinic. Then confirm patient details. So you are Ms. Dina and you are 21 years old. Then build good rapport. Please have a seat. May I sit beside you? Then explain note taking, which is very important and very helpful in the exam. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Then agree the agenda. I have received a letter from your GB stating that you have fatigue. Is it right? After the introduction, go to dialogue and start the dialogue with the present history and the presenting complaint. Can you tell me more about your fatigue? What do you mean exactly by fatigue? Do you mean excessive tiredness or weakness? Weakness might suggest neuromuscular disorders like myasthenia gravis. Can you tell me about any new or unusual circumstances in your life when you first noted this fatigue? Then the analysis of the presenting complaint by the bara. O is the onset. Did it start sudden or gradual? Did the fatigue begin following surgery or acute infection or acute illness? D, duration. Can you remember when exactly your fatigue did start? How long have you been experiencing this fatigue? Then P, progression. Is the fatigue worse with time, usually with organic causes? Do you feel more fatigued in the morning, in depression, or at the end of the day, like in myasthenia gravis? Then after progression, aggravating factors. What does worsen your fatigue? Does the fatigue worse with activity and better during rest? Does your fatigue only happen with exertion like in myasthenia gravis? Regressive factors. What does relieve your fatigue? Does your fatigue improve after a good night's rest? Do you feel better on weekends? Then associated symptoms, which are very important, and you might ask about many other symptoms. So do you have any fever, night sweats, or weight loss, like an infection or lymphoma or TB? Do you have any weight loss, like eating disorder or malabsorption syndrome? Do you have lightheadedness or on standing, dizzy on standing, anemia or adrenal insufficiency, large glands in your neck or lumps in your neck, like an HIV and infectious mononucleosis and lymphoma, joint pain and stiffness in rheumatoid disease, rheumatoid arthritis or Lyme disease, back pain like in multiple myeloma or metastatic cancer, excessive thirst and urination, unusual thirst and drinking more water, diabetes mellitus or diabetes insipidus. Also, do you have any cough, hemoptysis, and or breathlessness like in TB, tummy pain, peptic ulcer disease, or inflammatory bowel disease? You have any double vision in myasthenia gravis, weight gain or cold intolerance in hypothyroidism, heavy snoring, nocturnal apnea, morning headache, falling asleep at work or falling asleep in front of television or while driving, which is daytime somnolence, like an obstructive sleep apnea, increased pigmentation in skin or mucous tissue inside the mouth, Addison disease, shortness of breath with mild exertion, like in anemia or heart failure. Then there is a specific questions you have to ask in fatigue station. Ask about depression. How would you describe your mood? Have you been feeling sad or down? Have you been more irritable or angry? Have you lost interest in social activities? Have you lost interest in sex? Have you had guilty feelings about anything lately? Have you ever thought in hurting yourself? This is our screening questions for depression. After present history, we'll go for past history. Have you ever been diagnosed with any medical condition? Have you ever been diagnosed with anemia? Have you ever been treated for anemia? Have you ever received blood transfusion? Do you have high blood pressure, high blood glucose, and for how long? Have you ever had blood disease, gland disease, or cancer? Have you ever had any psychiatric problems like anxiety or depression? Have you recently had any surgeries, minor operations, or procedures? Then ask about medications and allergy. Are you currently taking any medications? What medications are you taking? And any over-the-counter, any herbal remedies are you currently taking? And ask specifically about benzodiazepine, non-steroidal anti-inflammatory or anxiolytics. And don't forget to ask about allergies. Do you have any sort of allergies? Are you allergic to anything? Then family history, ask about any similar condition in your family. Are there any illness or disease that run in your family? Does anyone in your family have colon problem, gland problem, joint problem, or cancer? Like rheumatological disease, autoimmune disease, and inflammatory bowel disease. Then ask about social history. Have you had more stress in your life lately? Have there been any problems in your family? Have you had more pressure at work? Have you experienced a death of a close friend or relative? All of this might be in psychogenic fatigue. When is the last time you had a vacation? This is work-family balance. Have you stopped exercising? Do you drink alcohol, which might increase obstructive sleep apnea? Do you smoke? How many cigarettes per day? Do you use drugs as heroin, cocaine, or other illicit drugs? I am sorry to ask you private questions. Are you married? Do you have any partners? Do you have any siblings? May I ask males or females, and how are they? We need to ask about how's the situation at home. How are things at home? Does anyone else live at home with you? Can you tell me about him? Any social support at home? Are you coping well? Can you afford it? Has your fatigue affected your ability to perform responsibilities at work? Is he going to work or he's taking a lot of sick leaves? Do you have any financial challenges due to your fatigue? At the end of the dialogue, don't forget to ask about ideas, concerns, and expectations. What do you think might be causing this problem? Are you worried about this being anything in particular? What do you think might be the best plan of action? Then the closure of the station. Summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Is there anything else we haven't discussed that you feel is important? So I think you have disease of your glands called Addison disease, which means less cortisol hormone in your blood, which causes this fatigue. Then plan the next few steps. I will examine you first. We may need to do some tests in the form of blood test and may do some imaging. This can be done on outpatient basis. Then I will decide whether to admit you or not. Then counsel on health promotion for smoking, alcohol intake, or HIV testing. There are some advice I need to tell you about. Smoking is not good for your health, and I'm going to arrange another meeting to help you to quit if you wish. Is there anything unclear you need me to clarify? And at the end, thank you, Mr. Mohammed. Thank you all. And these are some presentations in our free medical courses. Thank you and see you soon.